All right, so if I had to do one subject that would really matter a lot to pharmacology, I would say it's local anesthesia. Why? Well, again, understanding pharmacology means understanding local anesthesia and vice versa. Plus, man, if I had to pick one thing that could cause you grief in your office on a daily basis, one thing we do in dentistry all the time that could lead to medical complications would be anesthesia. I often tell my students, when they're learning anesthesia for the first time, love you guys, but you really are wielding a deadly weapon, you know? And so use it cautiously and be advised that you've got to be on top of your game if you're administering anesthesia. Now, a lot of people hear me say this and say, come on, I do this all day long. I give injections all day. I never have a problem. Everything's fine. Great. But I'm happy for you as long as you never had that issue. But, I, as a speaker and having, at this point, I think I just crossed 1,000 presentations in my career so far. Hard to believe. And having taught as many years as I've taught in dental schools and hygiene schools, now going on 25, I've seen a lot, just from sheer aggregation, right, of all those experiences. So there are complications. I serve as an expert witness in testimony sometimes, so I've seen a lot of those cases go to trial and sometimes get settled out of court, but there's always depositions, there's always expert witnesses, there's always everybody who thinks they're smarter than everybody else in the room. So I would say, lucky for you, and I'm happy for you, and bless you if you've never had any issues. But if you've had, you know exactly what I'm talking about. Let's not wish for any more. So we'll start off with anesthesia, and we'll give it the comeuppance, the respect that it deserves.